32 new cases of community transmission in Australia today. Nearly 12 million Australians under lockdown restrictions. Queensland has recorded 3 new local cases on day 1 of its snap lockdown. All are considered low risk. The total number of active cases in the state is now 42.
A lot of these active cases are the Delta variant, and we know that is very contagious.
No new cases recorded in the NT, but Alice Springs has entered a 72-hour lockdown after a man from the Tanami mines spent time at the city's airport.
The territory is still under threat. So long as that threat is there, we will do whatever it takes.
Day 5 into its 2-week lockdown, New South Wales has recorded 22 new cases. Good news, 11 of those were already in isolation while infectious.
To date, our fears about huge escalation haven't materialised, and we certainly want to keep it that way.
WA has just 1 new case on the first day of its 4-day lockdown, bringing the northern suburbs cluster to 4.
That case 1028 has been in quarantine and was not expected to have been infectious in the community.
Just 1 new local case of the Kappa variant has been recorded in Victoria, linked to its previous outbreak, the state further tightening border restrictions.
Right now, today, this all feels like a very volatile situation.
South Australia avoiding lockdown despite 5 new cases, all in one family, all linked to the NT goldmine cluster.
There's still a risk, but in this case, we are satisfied that this is the appropriate response for today.
Epidemiologist Professor Nancy Baxter joins us now. Professor, WA announced a lockdown as soon as it reached 3 cases. South Australia has resisted lockdown with 5. Why are states continuing to respond so differently?
Well, I know it looks like the response is very different, but when you have very small numbers, what's behind the cases is actually really important. In Western Australia, you had someone who was in the community for at least 4 days, potentially infectious, had been to a lot of places like gyms and things like that. So there were a lot of contacts that person had. Whereas in South Australia, this is one of the miners that came home on the 25th. And they arrived in South Australia, they tested negative actually, and then they subsequently had a positive test. And they've been in isolation since the 26th. So not a lot of contacts there, although there was that contact on the flight. So although they're positive and they have given it to a number of people in their families, there's less of a community risk. So you can see why the South Australian government is saying, let's see where this takes us. Let's test all those people in the plane. Let's find people in the airport, and let's see if there's been spread before we decide to lock down the whole city.
Meanwhile, the Northern Territory has locked down Darwin a little while ago and now Alice Springs. This is all from that gold mine transmission. Is that transmission a really concerning one?
Well, what I'd say is that they're looking at things in context. So it's the same miner that actually went down to South Australia that was in the airport at Alice Springs for 6 hours. Had a mask on the whole time, but, you know, I mean, if you're in a place for 6 hours, you're going to take off your mask to eat and do things like that. Lots of contacts that might be there. It was on the 25th, so there's lots of opportunities for there to have been community spread. And when you think of Alice Springs and the regions, very isolated, very high risk if COVID does spread in those communities, that there are going to be a lot of people who get sick and have somewhat limited access to medical care. So, you know, I think that they were using really an abundance of caution, but that's where they're coming from in terms of locking down Alice Springs.
New South Wales is currently in the middle of a 2-week lockdown, and they haven't seen the case surge that they were expecting. So do you think that the 2 weeks will be enough?
Well, I mean, fingers crossed. I was definitely expecting more cases to be apparent in the first few days, because it takes a while for lockdowns to take effect. And the other thing is that Sydney has great testing numbers, so it's not like we're likely to be missing a bunch of cases. So I think this really is where they're at. Remember, though, that these things have a long tail. Although a number of people have become COVID positive very quickly after exposure, there are going to be a lot more that become positive down the line, because they can turn positive up to 14 days. Fortunately, they'll be isolated already, so they won't be a risk to the community, but be prepared. There likely will be more numbers coming up. It'll probably take a week or so before those numbers really start to trail down. And then fingers crossed that Sydney can get out of lockdown. They're not going to be getting out of lockdown and living like they were before, though. There are going to be a lot of restrictions before they can really be sure that they've ground this to the ground.
Nancy, Victoria seems reasonably under control at the moment, but understandably there's probably still a few jitters. How cautiously optimistic should Victorians be?
Well, Victorians are always anxious about anything COVID right now. I mean, it's we've been once bitten, twice shy. I do think that we were already in masks. So when these outbreaks started happening around the country, Victoria's already been in masks. So that adds a layer of protection, even for when you don't know COVID's in the community. If you're wearing a mask, you know, it does reduce everyone's chance of either transmitting it or getting it from someone else. I think we're also not back to normal numbers and density in our office places. And so we've been protected from this, fortunately. And we probably need to start living more like this long term until we're all vaccinated.
Vaccination. We should talk about that. Thank you very much for joining us, Nancy. Appreciate it.
Good segue.
I've never been congratulated on a segue by a guest before.
You should be, Wally. They're good.
When you came into work on a Segway, I congratulated you.
Yes, that's true. The unfortunate thing about that congratulations is we're not actually segueing to a vaccine segment.
No, but we do have plenty coming up right after this.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.